Thanks so much for being with us here on Business Weekend. Well, the former Health Minister, Greg Hunt, was at the forefront of Australia's defence against COVID. In that period, it gave us lessons, and that was that our health system needs to be resilient and also have a sovereign capability for basic things, medical equipment like gloves, masks, testing kits, but just as importantly for vaccinations as well. Well, since leaving Parliament, Greg Hunt has rarely spoken. He is the Honorary Melbourne Enterprise Professor at Melbourne University and the Chair of the Advisory Council at the Turner Institute for Brain and Mental Health. And this week he was appointed a director to the private company HaemaLogiX, which is developing drugs to treat serious blood disorders, most notably the blood cancer myeloma, which affects around 20,000 Australians. And Greg Hunt joins me now from Melbourne. Greg, many thanks for your time. Can I just start with, before we go into, say, HaemaLogiX, I want to just start with Australia's response to COVID. You've just put a submission in to that COVID response inquiry. I just wonder about the future resilience of Australia if and when another pandemic occurs.
Well, the first thing is there will inevitably be another pandemic. We don't know when, but we do know that the likely frequency, because of interaction between humans and animals, because of the movement of humans, makes it more likely. What we also don't know is the type of it. It could be another coronavirus. It could be pandemic flu. It may be that we have a biological outbreak. If you think of foot and mouth disease and the way something like that can spread, you have an enormous number of different options, and you can imagine that or other diseases which have a biological basis affecting humans. So we have to have capability to prepare for all of the outcomes without ever knowing what will be the exact form. And that was what we had good preparation for in Australia. The National Critical Care and Trauma Response Centre, which houses the Australian Medical Assistance Teams, or the SAS of medicines, the National Medical Stockpile, and then the National Incident Centre, which is like the nerve centre. All of those are in place with pandemic plans, and that's why we were able to have a result which, as was recently published in The Lancet, saw a global decrease of 1.6 years of life expectancy over the first 2 years of COVID, but an increase of 0.2 years in Australia. What do we need going forwards? That's about a combination of sovereign manufacturing capability, but also that continued nerve centre capability for rapid decision making.
I was going to ask you about exactly that, because decisions have to be made quickly, and it would be fair to say that the world and Australia did respond quickly. Now, it might have seemed like it was a headlong panic at the time because we were heading off something, but the reality is, even when you look back in hindsight, the death rates in Australia were much lower than in other parts of the world. But then you've got to coordinate state and federal governments. Trying to do that in itself can take time to bring together.
So my view and my submission to the inquiry is that the National Cabinet is an enduring mechanism and should be the primary vehicle for coordinated national decision making. I'd like to see the states sign up to that. Obviously, they will retain and have to retain powers for unilateral action, but where they deviate from national cabinet decisions, that there is written, signed medical advice from the Chief Health Officer or Deputy Chief Health Officer of the state or territory. And I think that's an important check and balance whilst retaining a coordinated national mechanism, but with individual state flexibility.
So closing the borders in hindsight to China was one thing, closing state borders was something else altogether. And of course, many people argue that Australia's borders were too tight, that they were closed for too long, and that potentially hurt Australia's economy and cost the government more money in welfare to support the economy.
Well, I think the external borders were probably the most important defence, and the decision to close the border on the 1st of February 2020 is arguably the most important peacetime decision made in Australia since the Second World War. They contributed borders, testing, tracing, distancing, as well as building capability to the reason Australia had an increase in life expectancy when the average globally was a decrease of 1.6 years. So a massive human difference. There is a legitimate debate around some of those internal borders, and there were not in many of those cases federal examples of medical advice that supported that, or national cabinet examples. So that's why I would like to see, going forwards, the use of the national cabinet, but with the strong discipline of written, signed medical advice at the level of the Chief Health Officer at state level, where they're varying from that national agreement. And I think that's a good way forward. There is flexibility. States are not going to give up their flexibility, but there is a check and a balance because ultimately we always have to balance our freedoms versus our responsibilities to save lives, but we are fundamentally and in our essence a free society, and it's critical to maintain those liberties.
Okay, so I just want to go to, even as Health Minister, you would have sat in budget expenditure reviews where you've sat down with a Finance Minister and said, listen, we need warehouses full of, well, vaccinations to safeguard Australians against A, B, C, D and E. And the Health Minister or whomever comes back to you, or the Finance Minister or whomever comes back to you and says, hey, we don't have the money for that extra $1 billion, 800 million. How do you balance that as a minister, as a government going forward when you don't quite know where the next pandemic might hit?
So there are physical items which are universally applicable. Gloves, gowns, goggles, masks in particular. So we have a national medical stockpile and we replenish that. Although many of those items are perishable, so you have to maintain the balance, but also have the capacity to import and to maintain those lines. We did that magnificently as a country in terms of that rapid work to support what was already in place with the National Medical Stockpile. Then things such as vaccines, exactly as our initial discussion started, we don't know the form of the next pandemic. So therefore you have to have the capability.
And that even goes to the heart of your new board seat on HaemaLogiX. And that's by keeping more of the science here in Australia for our own sovereign capability. We have CSL, which is a global leader. Correct. We have one of the most significant exports of nuclear medicine, of course. So, businesses like this are important, not just for export sales potentially, but for also our own national capability.
Exactly. So you have, for example, CSL, ResMed, Cochlear, amazing Australian success stories. For me, I was looking for what might be the next one of those, in the sense that always keeping an eye open, and HaemaLogiX approached me. They're a blood cancer therapy company, but they're a platform. And what really excited me, without ever making, promises more than the science shows at this point in time, is you can deal with conditions such as multiple myeloma, potentially amyloidosis, potentially certain classes of autoimmune disease, where you have an antigen, which is like a signature that expresses on a diseased cell, and they've got a series of different treatments, what are called immunotherapies, CAR T therapies, and possibly bi and trispecifics that can address with a much lower side effect and a much better outcome than existing treatments. So 1,000 people die in Australia from multiple myeloma any 1 year, and the phase 2B trial results were really heartening, wonderful results in terms of human lives being saved, and that in turn means that you have potentially a high value, high commercial opportunity Australian company which can help patients around the world and do exactly what you're saying.
And I think, Greg Hunt, that many people do underestimate the skills and the capabilities of Australian medical technology. I appreciate your time, Greg Hunt. Good to chat to you.
Pleasure. Take care, Ross.